there is something that I need to talk about that I've actually never spoken about before on any of my social media. It's a little bit of a sensitive topic, which is why I haven't addressed it before, but I'm starting to see this issue again and again and again, and it's something that I experienced myself that I think I need to talk about it now. And it's to do with breast milk having a negative impact on sleep. Now you can see why I haven't spoken about this before. It is a sensitive topic. I don't want anyone listening to this to blame themselves if they feel like this might be happening. I don't want you to feel guilty, and I also don't want you to worry that you need to give up breastfeeding in order to get sleep. As I mentioned, I've experienced this myself. I breastfed my son to 2.5 years old with this problem, and I also support families who experience this problem as well to continue breastfeeding and try and improve sleep as well. So the issue is that a mother's gut health can negatively impact a breastfed baby. And what I mean by this is that there can actually be several contributing factors, and I will try and list the ones that I've found. Now, there's not direct research on this, so this is what I'm seeing. We understand some things can happen, and we understand how other things can happen, and I am correlating these things together to explain what I see in the families that I work with. So the first is with the mother's microbiome. So a baby's gut is basically free of bacteria while they're in the womb, and as they move through the birth canal, their mouth and their body is basically contaminated with bacteria that will then colonize their gut. And this is how we know that babies that are born vaginally versus a C-section have a very different gut microbiome. So if the mother has an overgrowth of non-beneficial bacteria, this is what the baby is going to get. And then from there, that can cause problems for the baby. In addition to that, these non-beneficial bacteria that the mother has can compromise her nutrition. So she could be eating all the right foods, but because the bacteria is damaging the integrity of her gut and the gut lining, she may not be absorbing all the nutrients from it. So this will follow through to the baby in that the baby may not be getting enough of all the nutrients because the mother is also not getting all of the nutrients. Now, this is going to vary a little bit because there are some nutrients that a baby will get from breast milk that does not vary depending on the dietary changes, but there are other nutrients that do vary depending on what the mother consumes. So that can really vary a lot. And then the one probably biggest factor that I see is that when the mother has compromised integrity to their gut, things that are supposed to stay within the gut lining, within the GI tract, they're supposed to stay within there and get processed within there, are leaking outside of that and into the blood. And breast milk is made from blood. So whatever you get in blood, you're going to get in breast milk. So if there's things leaking into the blood that are otherwise not supposed to be there, the baby is going to get it in the milk, and then their body has to process it. And then in addition to that, if there are non-beneficial bacteria overgrowths in the mother's gut, these bugs are also going to be producing toxins that also go into the bloodstream and are going to be going into the milk. So this is another thing that the baby has to process. And basically what I'm seeing from what I can understand is that it's overloading the baby's system. It's damaging their gut integrity, and it's also overloading their detox systems. And there's also research to suggest that there's certain things in breast milk that helps the baby's gut to mature. And a lot of these things come from the immune system, and a very large portion of our immune system is in our gut and in the lining of our gut. So if the lining of your gut is compromised and you're not actually producing all of the immune cells and all the things that you're supposed to produce, it means that the baby may not be getting as much of them either. And then it further contributes to the lack of maturation of their gut and lack of healing their gut. All babies have leaky gut, so it just doesn't allow their gut to heal and mature so that they're ready for food. So as you can tell, it's a bit of a complex subject. There is no solid research to confirm what I'm seeing, and then there's actually no way for me to 100% confirm that that's what I'm seeing, because there's so many factors at play. But I've had many families in the past year that mum has had very clear indications that there are significant gut health issues, and they've had toddlers, so they're a little bit older kids. As soon as they've weaned, they've actually started sleeping through the night. So this basically says to me that there is something coming from the mother's body that is disturbing, maybe causing them gut pain, maybe overloading their detoxification systems. But whatever it is causing sleep to be disrupted. And this can be a bit of a hard pill to swallow, because what are you supposed to do, especially if you have a little baby and perhaps you've fought really hard to get breastfeeding established? Well, there is absolutely no reason to stop breastfeeding as far as I'm concerned. I'm a huge advocate for breastfeeding. There are things that you can get in breast milk that you can't get in alternatives. So I absolutely would never tell a family to stop breastfeeding to resolve this problem. But with the right support and understanding what's going on with the mother's body, you can manage the problem as best as possible to support both the mother's and the baby's gut and their detoxification, so that you can improve their sleep without having to wean. So this is probably the first time that you've ever heard someone say something like this. And I truly do not want you to feel guilty or to blame yourself or to think that this is your entire problem. There are often multiple things at play, and it is absolutely not your fault. It's just not. This is just the way the world that we live in right now, that doesn't have a focus on gut health and nutrition. And it basically tells you that if you're not sick, then you're fine. But because it's not so black and white, there's grey in between, where you can have gut health issues, but you can still function okay. And no one tells you that this can impact your baby or their sleep or anything like that. This is just the world that we live in now, and it is absolutely not your fault if you feel like this is happening to you. However, I encourage you to reach out to me, have a chat to me. I have my Sleep Well Revolution program where I can help you through these issues so that you can get sleep and continue breastfeeding.